Good evening, everyone. Can you listen to me?
Yes, teacher.
Okay, thank you. And can you watch my screen?
Yes.
Perfect. Let's start then. Okay, so we have Ale. Can you read this part, please? Let's talk about the heart and circulation.
Okay, teacher. The heart and circulation 1. Shortness of breath or breathlessness is dyspnea. At first, this is caused by exertion, physical activity such as climbing stairs, but its several causes. It may present even at rest. A patient who is breathless when lying flat, orthopnea, or for example in bed, will tend to sleep raised up on 2 or more pillows. The abbreviation SOAP stands for shortness of breath on exercise or on exertion or on effort. Patient says, I get terribly short of breath climbing stairs. Doctor can ask, how many pillows do you sleep on?
Okay, thank you so much. Yes, we have the shortness of breath or breathlessness, okay, that on your careers you call dyspnea too. So at first, this is caused by exertion. And what is exertion? A physical activity such as climbing stairs, okay? But in severe cases, it may present even the red who is breathless when lying flat, like in orthopnea, for example, in bed, will tend to sleep raised up on 2 or more pillows. The abbreviation SOBOI stands for shortness of breath on exercise, okay? Or on exertion or on effort. And as you can see, the patient may say, I get terribly short of breath climbing stairs. Or another, or they can say another thing. For example, I cannot breathe. I have trouble when I'm even walking, right? And doctors can ask, how many pillows do you sleep on? Do you have any other kind of question that you can make in these cases?
Maybe what kind of activity you do when you feel this shortness of breath?
Okay, perfect. What else? Another one?
Do you feel tired when you walk to the bathroom?
Okay, Carla, thank you. Okay, let's go. Jethro, can you read this part, please?
Yes, miss. Good evening. Heart and the heart rate. The normal resting heart rate is the 65 or 75 beats per minute. And athletes, it may be as low as 40 beats per minute. In the extreme athletic activity, the heart rate can go as high as 2000 minutes. The 200, sorry. The heart rhythm may be regular or irregular. In a irregular rhythm, arrhythmia, there might be early beats which interrupt the regular rhythm, premature beats, or the rhythm Mary Berry with
Yes, I'm
respiration,
sorry. Mhm.
or it may, teacher?
I'm so sorry. There is a mistake. May vary. Okay, continue, please.
Okay, or it may be completely irregular, as in fibrillation, when patients are aware of irregularity, they describe the symptom as palpitations. Case 4, a 22-year-old student was admitted to hospital with a long history of heart problems. She had been increasingly tired with shortness of breath on exertion,
Exertion.
orthopnea, and palpitations. A mitral valve replacement had been carried for 3 years previously, and this had stabilized with the symptoms of heart failure, but was followed by episodes, attacks of atrial fibrillation, which had been particularly severe for the 6 months before admission.
Okay, thank you so much. Well, we have the normal resting heart rate is between 65 and 75 beats per minute. Okay, in athletes, it may be as low as 40 beats per minute. In extreme athletic activity, the heart rate can go as high as 200 per minute. And the heart may be regular, or the heart rhythm, sorry, may be regular or irregular. Okay, in an irregular rhythm that we call an arrhythmia, there may be early beats which interrupt the regular rhythm. That is a premature beats. Okay, and or the rhythm may vary with respiration, or it may be completely irregular, as in fibrillation. When patients are aware of irregularity, they describe the symptoms as palpitations. Okay, and you can see this case 4. A 22-year-old student was admitted to hospital with a long history of heart problems. She had been increasingly tired, with shortness of breath on exertion, orthopnea, and palpitations. A mitral valve replacement had been carried out 3 years previously, and this had stabilized the symptoms of heart failure, but was followed by episodes. What are those episodes? We can call it attacks, okay, of atrial fibrillation, which had been particularly severe for the 6 months before admission. Okay, so do you have any question here, or is everything understood? Jocelyn, is there any question? Okay, I think it's understood, right? Let's continue then. Carla Barta, can you read this part, please?
Okay, good evening, Miss.
Good evening.
Heart failure.
Yes.
Heart failure occurs when the heart is unable to maintain sufficient cardiac output, the amount of blood pumped by the heart each minute, for the body's needs. It may involve the left side of the heart, the right side, or both. In left heart failure, the main symptoms is breathlessness. The symptoms of right heart failure include peripheral edema, swelling,
Yes, yes.
okay, beginning in the feet and ankles. This is known as pitching edema. If when a finger is pushed into the swelling, it causes a small depression or pit.
Okay, thank you so much. Yes, heart failure occurs when the heart is unable to maintain sufficient cardiac output. Okay, and that is the amount of blood pumped by the heart each minute for the body's needs. It may involve the left side of the heart, the right side, or both. In left heart failure, the main symptoms is breathlessness. The symptoms of right heart failure include peripheral edema or swelling, okay? Beginning in the feet and ankles. This is known as pitting edema. If when a finger is pushed into swelling, it causes a small depression or pit. Okay, do you know, I don't know, but I think there is a specific name for this kind of condition or this test, I think, this pitting edema. Anybody can tell me?
In Spanish, it's called phobia.
Okay, perfect. Yes, that is what we are describing here. Does anyone has any question here?
No, teacher.
There. Okay, we will play a little, okay? Mateo, are you here? Well, he's not. Then Claudia. Claudia?
Hi, teacher.
Claudia, can you find, we can make a match with this word dyspnea?
Okay, dyspnea
Mhm.
is shortness of breath or breathlessness.
Okay, we will find out later. Then, Rina, can you go
Yes.
with the second word?
Yeah, arrhythmia. In a irregular breathing.
Okay, we will find out. Thank you. Well, Ale. Alejandra Macías.
Orthopnea, a patient who is breathless when laughing flat.
Okay. And Weimar.
Teacher?
Weimar, you have to choose on the other side the description of a word that in this case is edema.
Okay, teacher.
Okay.
Um, volume increasing.
Okay. In this case, the only one is swelling, right? Let's find out. Thank you. Entonces, arritmia. Arrhythmia, it means in an irregular rhythm. Dyspnea, shortness of breath or breathlessness. Orthopnea, a patient who is breathless when lying flat. And edema, swelling, right? Okay, so that was good. Very good. Let's go to this part. Melanie, can you read this part, please?
Yes, miss. Well, the physical examination, medical examination is normally carried out in four stages: inspection, looking; palpation, feeling with the hands; percussion, tapping with a finger; and auscultation, listening with a stethoscope. Note, the verb is palpitate, the noun is palpation, not palpitation.
Okay, thank you so much. Yes, well, here on the physical examination, as you told us yesterday, you told us that we have 4 parts on this physical examination, right? Here we have that there goes in 4 stages. In inspection, that it's looking; palpation, feeling with the hands; percussion, tapping with a finger; and auscultation, listening with an stethoscope. Note, the verb is palpitate and the noun is palpation, not palpitation, okay? It's a thing to remember. I want to know, I don't know, I need volunteers. What do you expect to find on inspection to say that your patient has some trouble on this area? Or on this for this condition, right? On heart and circulation. Okay, what do you expect to find on inspection? Nobody?
Yeah. In the inspection, I expect I have to see the appearance of the person. In Spanish is the las facias of the patient, the breath, the kind of the breath, only with the inspection. If the patient has diaphoresis, how the patient is sitting in that moment, and the patient has painful, and that is evidence only looking.
Okay, thank you, Rina. Anyone else?
Well, specifically in heart failure, also we can find on the inspection the jugular ingurgitation, I don't know.
Okay.
Ingurgitation, yeah. And also when the damage is a systolic failure, we can find in the auscultation and R2 reinforces, I think, the second, I don't know how to explain the second noise. of the heart, I think, or the second beat, it's reinforced when when we have a systolic failure or the diastolic failure. Sorry.
Okay, Claudia, thank you so much. And what about palpation? What do you expect to find to say that there's something wrong on your patient or make a diagnosis?
With the palpation, you can feel the edema, and you can classify the grade of the edema.
Okay. Anyone else?
Maybe the heartbeats, if they are regular or irregular.
Okay. What else?
Maybe when the patient has palpitations, you can feel the heartbeat with the hand.
Okay, thank you. And what can you say about percussion?
With the percussion in the thorax, is I'm looking for the sound, the pen of the sound with the percussion in the thorax. We can define if the thorax has air or liquids in the thoracic cavity, and that on the percussion.
Okay, thank you, Rina. And finally, the auscultation. Anyone else but Rina? Nobody? Okay, Rina, if you wanna give us an example.
Yeah. In the auscultation, in the heart, well, in the thorax, in fact, the auscultation is useful for listen or for pay attention with the sounds. The first and the second sound of the heart, we can find soplos or some disease in the heart or some abnormality in the function of the valves in the heart that called stenosis, or we can find soplos with the if we put the stethoscope in the specific area in the thorax, that is called focus, the mitral focus, the mitral aortic focus, pulmonar focus, and tricuspidal focus. I think that is the point specific when we have to put the stethoscope.
Okay, Rina. When we talk about soplos, we can say murmur, okay?
Okay.
Heart murmurs. That's what are you looking for with a stethoscope. Thank you so much. Well, Carla Calle, can you please read this part?
Sure. Examination the heart and circulation. Look at the lips, tongue, and nails for the blue discoloration of cyanosis. Cyanosis may be central or peripheral. Inspect the hands for clubbing. Feel the radial pulse at the wrist and note the rate, for example, 70 per minute, and rhythm, regular or irregular. The pulse may be irregular in force as well as time. Check that the other peripheral pulses are present. Measure the blood pressure and assess the jugular venous pressure, GVP. Palpate the chest for the apex beat. The normal position is the fifth left intercostal space, 1 centimeter medial of the mid-clavicular line. Feel for any trills. Heart size may be measured by percussion. Listen for murmurs or and other abnormal sounds. For example, friction drops. Maybe I think there's a word.
Yes, I'm so sorry.
Sí. And sorry, I lose. Beginning at the mitral area, murmurs may be soft or loud. A harsh murmur is loud and raw. Note the time of any murmur in relation to the cardiac cycle. The most common murmurs are mid-systolic, in the middle of systole, pan-systolic, lasting for the whole of systole, early diastolic, mid-diastolic, late diastolic, pre-systolic, and continue by listening at the tricuspid, aortic, and pulmonary areas.
Okay, thank you so much, Carla. Yes, I'm sorry about this word. Okay. Listen for murmurs and other abnormal sounds. For example, friction rubs. Okay. This word, those words, friction rubs, will denote like, in Spanish we can say como frotar, un sonido como si estuvieran frotando. Por eso dice exactamente. Okay. Thank you. Do you have any other question of vocabulary here? Okay, but I don't know if you are agree with this kind of protocol, or if you do it in another way, or maybe you want to add something else.
Maybe looking the neck for this jugular ingurgitation.
Mm-hmm. In this case, we will call it engorge, okay? Instead of ingurgitation. Mm-hmm. Anything else? Do you understand the word inspect the hands for clubbing?
Son las manos en forma de palillos de tambor o de dedos en forma de palitos de tambor.
Yes, that's right. The deformity of the fingers, right? Or toenails. Okay. Anything else? there any question here? Can we continue then?
Yes.
Well, Jethro, can you read it again, please?
Yes, teacher. Infections, fever. A medical student has made some language notes or case report. Case 45. A 24-year-old woman presented with a fever, which she had for 3 days. On the third day, he had a severe attack of fever with sweating and rigors. The only past history of relevance was hepatitis 4 years earlier and glandular fever infection with Epstein-Barr virus. At the age of 18 years, he had returned from Africa three weeks previously. Fever, pyrexia, also remember POO, pyrexia of unknown origin. Fever, also known as temperature, if got a temperature. Adjectives, feverish, febrile, and pyrexia. Opposites, afebrile, aphyrexial. Some symptoms of fever, sweating, rigors, severe shivering, and sensation of coldness, also known as chills.
Okay, thank you. Yes, in this case, we have a 24-year-old man presented with a fever, which he had had for 3 days. On the third day, he had had a severe attack of fever with sweating and rigors. Only past history of relevance was hepatitis 4 years earlier and glandular fever, that is an infection with Epstein-Barr virus. At the age of 18 years, he had returned from Africa 3 weeks previously. Okay, and on the right side, we have some vocabulary. Fever, it's equal pyrexia. Also remember PUO, okay, pyrexia of unknown origin. Remember that these are language notes or a case report for a medical student, okay? Fever, also known as temperature. For example, I've got a temperature. We made that example. We have adjectives like feverish, febrile, and pyrexia. The opposites are febrile, apyrexia. Okay. Some symptoms of fever might be sweating and rigors. And rigors are severe shivering and sensation of coldness, also known as chills. Maybe on your when you were students, or even now, you have some notes, right? Can you mention what do you put on your notes to remember? Maybe there is something that you always forget. Come on, don't be shy. Nothing? So you remember everything, guys? Not even one example? I'm shocked. Well, in my case, I forgot about, for example, the ranges of temperature or maybe of, well, the vital signs, okay, and I have to write down on my notes, and that helped me a lot. What about you?
Of the initials of some disease, like this example, for example, PUO, pyrexia of unknown origin.
Okay.
There's so many in medicine, I think so.
Yes, there are a lot, but the ones that you usually forgot, I don't know, but in your case, you're an anesthesiologist, right? So what are the things you forget the most?
Well, the TIVA infusions, I think, when I just do or make an intravenous anesthesia, I sometimes forget some of the doses of the drugs. And I have sometimes to refresh my mind to prepare the specific drugs in the specific quantity of solution, and to prepare according to the patient and the kind of surgery.
Yes, perfect, Claudia. Thank you so much. That's a good example.
Thank you.
It happens to me too. Okay, so Jocelyn, can you read this part, please?
Okay, teacher. Microorganisms infection differ from other diseases in a number of of, as- of aspects. Most importantly, they are caused by living microorganisms such as virus of or bacteria that can usually by identify thus establishing the etiology early.
Sorry, this is etiology, okay? I'm so sorry.
Yeah, okay. Etiology early in the illness.
Illness.
Many of these organisms, including all bacteria, are sensitive to antibiotics, and most infections are potentially curable. Unlike many infections, degenerative and chronic diseases, communicability is another communicability is another factor with different effects.
Differentiates.
differentiate infection, hormone infection, disease, transmission on pathogenic organisms to other people directly or indirectly may lead to an outbreak or epidemic. Finally, many infections are preventable by hygienic measures by vaccines, especially live attenuate vaccines such as rubella vaccine or by drug ¿cómo es?
Drug.
prophylaxis. Eh, For example, chloroquine to prevent malaria.
Okay, thank you. Okay. Infections differ from other diseases in a number of aspects. Most importantly, they are caused by living microorganisms, okay? Such as viruses or bacteria that can usually be identified, thus establishing the etiology early in the illness. Many of these organisms include all bacteria are sensitive to antibiotics, and most infections are potentially curable. Unlike many non-infectious degenerative and chronic diseases, communicativity is another factor which differentiates infections from non-infectious diseases. Transmission of pathogenic organisms to other people, directly or indirectly, may lead to an outbreak or epidemic. Finally, many infections are preventable by hygienic measures, by vaccines, especially live attenuated vaccines such as rubella vaccine, or by drug prophylaxis, for example, chloroquine to prevent malaria. Okay? Do you have any vocabulary questions here? This is just to mention some parts. Jocelyn, do you have any questions here?
No, teacher.
Okay. Okay. Microorganisms include bacteria, viruses, fungi, protozoa, such as the parasite that causes malaria. Another general word for these pathogens is microbes. Patients often refer to microbes as germs or bugs. Notice the common expressions for acquired and infectious disease. Could he have caught some disease from the dog? Or could he have picked up some disease from the dog? I think I caught the flu bug that's going around. Okay, have you heard, in your experience, have you heard any other way that patients come to your consultation when they are sick and describe in another unusual way? Nobody? In your when you make your rural year, you didn't have any experience with this?
Maybe
Maybe
it could be I have infected.
Okay. Okay. Another way to say it. I don't know who else wants to speak. Thank you, Carla.
well, for example, um, in some places it's very common ankylostomiasis, I think, and the people usually called the with the worms or wormness. I don't know how to say gusanera.
Okay.
That it's a kind of parasite.
Yes.
That is the
Yes.
common way that it calls to ascariasis or ankylostomiasis.
Yes. It's so common in some areas.
Tropical
Thank you.
areas. Yeah.
Thank you, Claudia. Okay. Let's continue then. Claudia, can you read this part, please?
Okay. Source and spread of infection. Here an extract for a medical textbook. Infection may originate from the patient endogenous, usually from skin, nasopharynx, or bowel, or from outside sources, exogenous. Often, another person who may be either suffering from an infection or carrying a pathogenic microorganism. Carriers are usually healthy and may harbor the organism in the throat, for example, the diphtheria. Bowel, salmonella, or blood, hepatitis B or HIV. Non-human sources of infection include water, E.G. cholera, milk, E.G. tuberculosis, food, or E.G. botulism. Animals, E.G. rabies, birds, or psittacosis, and also the soil of Legionella, Legionnaires disease. The incubation period is the period between the invasion of the tissues by pathogens and the appearance of clinical features of infection. The period of infectivity is the time that the patient is infectious to others.
Okay, thank you so much. Just to remember, the infection may originate from the patient. That's what we call endogenous. Okay, or it comes from outside sources. We call exogenous. Often, another person who may be either suffering from an infection or carrying a pathogenic microorganism, carriers, are usually healthy and may harbor the organism in the throat, for example, diphtheria, bowel, salmonella, or blood, like hepatitis B or HIV. Okay, non-human sources of infection include water, like cholera, milk, tuberculosis, food, botulism, animals, rabies, and birds, psittacosis, and also the soil, like Legionella. Okay, the incubation period is the period between the invasion of the tissues by pathogens and the appearance of clinical features of infection. The period of infectivity is the same that the patient is infectious to others. Okay? Do you have any question for vocabulary here?
What is the soil?
Soil is suelo,
Ursuelo?
suelo, el piso,
Suelo.
suelo.
Ah.
Ajá.
Okay, thank you.
Okay. Any other question here? No questions? Okay. If you have any other question, you can do it on tomorrow's class. But please make questions, okay? I will share with you my questionnaires because I have two today. So I don't know where are they. Okay, something happened with my questionnaire. Guys, I will send it by the group of WhatsApp, okay? And I will ask you, please, to fill it or edit these questionnaires and send it back to me, okay? Just for this time. I don't know what was happening. Maybe I don't know, but that's the thing, okay? And I will ask you if you have time for the next week after the theoretical class to have our theoretical class that we have to replace for Monday. I need 7 people for Monday. Please, after the class, after 9, to replace.
It's okay for me, teacher, on Monday, please.
Okay, Claudia.
Me too. Me too, Carla.
Claudia, yes.
Claudia, Carla. Okay, okay, Jorge, Claudia, Carla, Calle. Rina.
Yes.
Okay, perfect. Claudia, Carla, Calle. Jorge, Rina, Alejandra. Two more, Melanie. And one more, please. One more, please. Carla, Barta. Can you on Monday? Do you have time?
Excuse me, Miss, what time will be the practical class?
After 9 p.m. it will be 9:15, 9:30. Let me check. 10. 9:45. Arena 10. Alejandra 10:15. Melanie 10:30. Okay, 10:45. I don't know if you're available, Carla.
It's okay.
Yes?
Yes.
Okay. Okay, thank you. So I have Claudia, 9,
Okay.
immediately after class, okay, 9. Carla Calle, 9:15. Jorge, 9:30. Rina, 9:45. Alejandra, 10. Melanie, 10:15. And Carla Barta, 10:30. Okay?
Teacher,
What
Is
is
that good?
the topic of the practice, teacher? Can you remember, please, for me?
Yes, I will put it on the group,
Which is
okay,
the
for
topic of the
everyone.
practice?
I will put it on the group, okay?
Okay.
Thank you. Jethro, are you available for Wednesday?
teacher, maybe I can do the Monday or not.
I have a 9 p.m. Jethro. 9 p.m., 15, 9:30, I don't know.
Okay, Wednesday it's okay.
Jethro, Weimar, well, Jocelyn and the others that they're not here. So they would be the practical class would have the practical class on Wednesday, okay?
Okay, teacher.
Miss, I
Okay.
have a question. The schedule is at the night?
I'm so sorry, can you repeat it?
Yes, the schedule, all the practice is at the night because
Yes, it's at night.
because I work from 9 p.m. Bolivia until midnight every
Oh
day.
no. Okay, Melanie, you can change with Jethro maybe. But every day,
Yes, teacher.
even Wednesday?
No, Wednesday, no, it's only my my free day, the Wednesday.
Okay, so Jethro, can you
Okay, for
change
me,
places?
you want to change?
Yes. Okay.
Oh, thank you very much.
No, don't you worry.
Okay. Jethro, 10:15, okay?
Okay,
PM.
and Monday.
Yes, Monday.
Okay, 10:15.
Yes.
Okay, thank you so much.
And
Thank you, Melanie.
thank you.
Thank you.
And Melanie, 9 p.m., okay? Right after the class.
The Wednesday, right?
Wednesday, yes.
Okay, yes. Thank you so much.
Okay, guys, thank you so much. Let me just take a picture here, and I will put on the group my questionnaires. I don't know what happened with them. And I will ask you, please, to fill it for me and send it back. Okay. Okay, thank you so much. See you tomorrow, and I will put the schedule on the group, okay? Thank you. Good night. Take care. Thank you, guys.
Night.
Night.
Bye, teacher.
Bye, teacher Michelle.